Hey everyone, we're going to go ahead and look at our notes for lower extremity bones. Don't worry, we will try to break this up into a few different videos. We'll just see how far we get, and we'll just sort of pick a natural stopping point. I'm hoping to at least get through the ilium, ischium, and pubis in this first video before we go ahead and take a look at our 3D model. So let's start off right here with those three bones. So I'm going to draw a few lines here, and what I'm doing is I'm trying to draw the boundaries of these three bones, because this larger bone here, which is called the coxal bone or os coxae, or you may even see it called the pelvic girdle, it's actually made up of three fused bones called the ilium, ischium, pubis. So that's what I'm doing, is I'm drawing out boundaries here to show where those three bones are. So the red area, we could carry this down. That this bone here is the pubis. If we go back to orange, this bone here is the ischium. And everything above the blue line I drew here, whole top very large bone is called the ilium, which is the bone we're going to take a look at first. So let's check it out. Now the first structure is called the iliac ala. That just refers to this large wing-like structure here. So I'm going to go ahead and draw a line. Everything above this line is considered to be a part of the iliac ala. Iliac crest is something you can feel. Put your hands on your hips, you can feel the top of this bone, this wing, and that is right here. Iliac crest. It kind of swells out a little bit here in the front. Iliac crest. Now it has three lips. We don't need to label them. It's going to be too difficult for me to quiz you on those, but if you were to draw a line on the most lateral point of that crest and the most medial point, those would be the lateral and medial lips. And then, of course, you have the intermediate lip in the middle. Okay, the two next structures here are the iliac tubercle. The iliac tubercle is right here. It's a part of this little swelling of the iliac crest right there. And the iliac pillar is right below that here. Iliac pillar. Okay, so now we have the ASIS and the AIIS. So the full name of these, which is what you would need to use on a quiz, the first one is the anterior superior iliac spine. That's right here. You can definitely feel that. You have two bumps on the front of your hips, kind of by your inguinal ligaments. That top most prominent one is called the ASIS, or anterior superior iliac spine. Then there's a small notch, and below that notch here is the AIIS, or anterior inferior iliac spine. My red. The notch I just mentioned a second ago in between those two is called the iliac notch. These are all sites of different muscle attachments. One of your quadriceps attaches here. All right, so just like we had an ASIS and an AIIS, we have a PSIS and a PIIS. Sorry, the acronyms get a little crazy. So this one here is the posterior superior iliac spine. And the one below it is the posterior inferior iliac spine. Keep forgetting color code, sorry. All right, and you can't see it super well here. The artist hasn't really drawn it in that well, but On a real bone, you can see that there's a pretty roughened patch just anterior to those two spines. I'm trying this way space there we go. And that's called the iliac tuberosity. The next structure is called the greater sciatic notch. It's located right here. That actually turns into a foramen once we add in some ligaments, and it becomes a place for arteries and nerves to travel. You can see there's another notch down here. That's on a different bone, so we'll label it later, but just so you know, this bigger notch is called greater sciatic notch, and then this little one is called lesser sciatic notch. Iliac fossa we can't label in this photo, unfortunately, so we'll have to do it on the model. It's just the reverse side of this. So let me just kind of give you a sense of what you're looking at here. I apologize. So this is a right coxa, this whole bone. It's a right ilium, a right ischium, and a right pubis. This big structure here is where the head of our femur attaches. So you could imagine then that this must be lateral. We must be looking at a lateral view. If our femur attaches here, since the femur attaches on the outside of our coxal bone, we must be looking at this from a lateral perspective. And we are, and it's the right. So that means that this is anterior, and this is posterior. A, which is why we called this anterior superior iliac spine and this posterior superior iliac spine. So anyway, I'm making that point because the iliac fossa is on the inside of your pelvis. It's on the other side of this big wing, so we can't see it, but we will be able to see it on the model. The same is true for the auricular surface. We'll have to see that on the model as well because it's on the medial side of this area right here. But that's okay, we'll take a look in a few minutes at the model. So let's move on to the ischium. Now, I could have, you saw earlier, this is slide 2, how I divided it up. So I could have mentioned that 1/5 of the ilium is, I'm sorry, let me start over, guys. I could have mentioned that 2/5 of the acetabulum is a part of the ilium, 2/5 is a part of the ischium, and 1/5 is a part of the pubis. It was in my notes when I took anatomy years ago, so I still have it jotted down to say, but in reality, I don't know if it's really that important. I certainly won't ask you guys to know what percentages or what fractions of this socket right here belong to which bone. But just FYI, that's what this means, is that 2/5 of the ischium is actually the acetabulum. So we just chose to label acetabulum on this slide, but we could have labeled it on the last slide as well. So here it is, this big socket that the head of the femur articulates with is called the acetabulum. There's there's actually 3, only 2 of them are on here for some reason, but there's 2 structures inside of here. I'm going to label all 3, but I guess we'll only quiz you. So here's the first one. It's called the acetabular fossa. That's kind of an interesting look, almost like a keyhole look to it. There's some blood that comes in there and enters the head of your femur. And then the notch here, which you'd really have to be looking at it from an anterior view to see, that notch is called the acetabular notch. Right here, so I'll just kind of highlight there. Acetabular notch. Then we have a really prominent spine called the ischial spine right here. Ischial spine, not the prettiest one I've ever seen. And then what you are most likely sitting on right now as you listen to this structure here is called the ischial tuberosity. And in between those last 2 structures, we have the lesser sciatic notch right there. Last structure for the ischium is called the groove for obturator internus. We have this interesting muscle that covers up this hole here. That hole is called the obturator foramen, which you'll learn later. There's a muscle called obturator internus. There's also a muscle called obturator externus. Well, anyway, this side that we're looking at here is actually the external side of that hole. That's the hole facing out. We would have to sort of go, we'd have to look from the other side. We'd have to be over here looking through this hole, and we'd be looking on the internal side. Anyway, there's a muscle on the internal side called obturator internus that covers this foramen, and it has a tendon that actually wraps around here on the other side and then comes back across here to attach to the femur. So that tendon actually goes through here to attach to the femur. So that is the groove we're about to label. It's called the groove for obturator internus. We'll do, I guess, yellow. This groove here is called the groove for obturator internus. There's a lot on these three bones. Hang with me, guys. So let's move on to the pubis. A few of these we'll have to see on our 3D model, but we can do our best to label. This first one, for example, symphysis pubis or pubic symphysis. There is a point of articulation between the left and right coxal bones, and that is in the front here at your pubic symphysis. It would be facing exactly away from us, so we wouldn't be able to see it. So I'm just going to draw a line here, but really you could only see it from that other side. We'll get a great look of it at the model, so don't worry. This next structure as well, actually several of these will be better served looking at the model, but it's just on top here. It's called the pubic crest. And let me just refresh your guys' memory. The pubis is actually only just not quite that dramatic, sorry. It's only about here. Okay, it's the pubis. Everything above the line is ilium, and then this bottom left is ischium. Pubic tubercle we won't be able to see here. Again, we'll have to use the model. Superior and inferior pubic ramus we can see. The superior pubic ramus is pretty small. It's right here. And then the inferior pubic ramus is here. All right, and let's label those. And then lastly, for the coxal bone, our last structure is the obturator foramen, this big foramen right here. And that's it. Let's take a look at the model. Thanks.